Welcome back to Keeping Hope Alive. I'm Jo Comerford, and you're going to hear right now from Dr. Sunny Shukla, who is the Chief Medical Officer at Cooley Dickinson Hospital.
My name is Sunny Shukla. I'm the Associate Chief Medical Officer at Cooley Dickinson Hospital and also an ER physician, and I'm originally from Missouri. So growing up in Missouri, my dad was a professor of pharmacology at the University of Missouri, and I would go to the hospital with him sometimes, and I was in awe of a lot of the physicians. They were helping people. I was seeing them in the hallways, and it was exciting to see them help people. I like being able to care for the community. I will see people at stores who I've taken care of. I once had a patient come up to me in Costco and be like, "Doc, I got a question. Can I eat cantaloupe still?" And it's those type of relationships are really, really important to me because I want to be a good source of information for people and help them lead a healthy life. I think access to care is really, really difficult for some people. After COVID, many people left the healthcare field. Access to primary care doctors or specialists is a challenging thing these days. So I think that access to care so patients can get the care that they need to stay healthy is what's really, really important, and that's a challenge right now. For Cooley Dickinson and myself, I really want to see us have availability for patients to be seen efficiently, quickly, and also be able to keep care locally. We've expanded services here in orthopedic surgery, general surgery. We also have cancer care that we provide locally, and these are things that are important to building a healthy community. Being involved in community events, volunteering are very important. So when I was in junior high, I actually volunteered at a hospital, and that gave me firsthand information on how hospitals run, how to help make an impact in certain people's lives on a daily basis. As an ER physician and people who work in the hospital, and we have challenging days too. We have people who die on us, we have people who have strokes, heart attacks, other medical conditions, and many times it impacts us significantly. So I will think about someone who had a bad outcome. I will think about a patient who wasn't successful in terms of getting better. And these things we take home. I think people realize that just because we are taking care of you doesn't mean that we don't think about these things. People have to understand that medicine is very hard these days. There's always challenges in terms of, like we talked about, access to care, but then there's also resources that we don't always have. So it's important for all of us to provide the best care for our patients with what we have. I think the biggest concern that a lot of us have right now is what the future holds with healthcare. There's a lot of cuts that we're seeing, and we want to be able to provide care for all of our patients. We believe in efficient care and having the best quality and safety in our hospital, and also the best patient experience, because we want people to feel welcome and want to come to the hospital. But with some of the cuts coming in the future, there's a lot of uncertainty for us. We pride ourselves on having one of the best healthcare systems in the world in the US, and so we want to be able to continue that tradition and also provide the best care for everyone. I think a lot of community outreach, being the source of true information, and then also mentoring people. There are many people in this community that are great for mentoring, and I make it an effort to mentor people around me because I think developing the future leaders of this community as well as the country is really important to me. We're always looking for volunteers. We're always looking for students to come help us and work with us, and staff. We have many jobs available here, and you can help build our community to be a better place to live. I think our community is awesome. We have such great leaders locally, and as a community, we're much stronger. This day and age, there's many things that are trying to divide us, but now is the time for us to come together as a community and really step up and protect each other and help each other.